Oh, thank you very much, Bülent. I hope it's allowed that I can start. Yeah, I still wait for a signal that I can start. It, se- it seems so.
Yeah, I think Bulan has a set to start. So Sabine, please.
Okay. Thank you. Thank you, Dave. Thank you so much. So, welcome everybody. And it's a great honor and pleasure today to present about, for me, a very hot topic, poverty and mental health. And I would like to thank my dear friend Bülent for this organization, for this possibility. And yeah, we know each other since decades. Thank you for your friendship. Thank you for this offer. And I will do my best with the presentation. So I hope that you can see now my slides. Is it possible for everybody? Dave, can you give me a signal?
Yeah, we can see.
Good,
Thank
wonderful.
you for accepting to be with us.
So, like you can see here again, my topic for today is poverty and mental health. A few aspects, only aspects. The presentation will be approximately 20 minutes long. And please interrupt me if you can't see my slides or if you have requests. I will start with a few words about poverty and mental health and poverty afterwards, and I will end with a few conclusions. So there is for me, a very good definition from the Federal Statistical Office in Switzerland. Poverty is defined as a lack of resources, like you can see, with several components, such as to exclude persons from the minimum acceptable way of life in the country in which they live. Poverty is often characterized by a lack of essential needs, including food, clothing, clean water, adequate shelter, and sanitation, limited access to education and health services, and unstable employment opportunities, and many others. I prepared a film for you, and I hope that you will see the film very well.
Poverty and inequality are universal. They undermine every society, everywhere. But poverty is not natural. It is man-made, so poverty is not inevitable. It's an area where the world has made huge progress in the past few decades. Just 30 years ago, there were 1.9 billion people living in extreme poverty, but that number has been transformed. In 2015, it fell to 734 million people. That's over 1 billion people lifted out of poverty. But still, almost 10% of the human race is living unbelievably harsh lives. This is largely determined by their circumstances at birth, and these high levels of inequality work against better opportunities for all. Opportunities that could change the world. A huge amount depends on where public money is spent. More of it must urgently go into health. into giving everyone a safety net. There is a revolution that is happening in education, connecting every school, every person to the internet. This can be done. The recovery from COVID must lead to an economy that works for everyone. Let's start with tax. We have widespread tax concessions, tax avoidance, and tax evasion, which means that there's so much less money for all the crucial things. Many developing countries are weighed down by historical debts, spending more money on debt repayments than they are spending on healthcare. And then there's the importance of global investment in peace. The peace dividend for the world is immeasurable, and we must break the vicious cycle of corruption and increase the power of the people to keep check on the people in power. A free, independent media and responsible social media platforms that encourage healthy debate. Equality unleashes the potential of everyone to improve their own lives and contribute to the lives of everyone else.
So I allow myself to step forward with the presentation. So the global extreme poverty rate in 2022 is revised up from 9.0 to 10.5%, corresponding to an increase in number of individuals living below the international poverty line from 713 to 838 million. At the regional level, all regions see upward revisions, most notably Sub-Saharan Africa, where the extreme poverty rate goes from 37.0% to 45.5% in 2022, except for South Asia, with a downward revision from 9.7 to 7.3%. Here again, with another slide, you can see the poverty rate in percent world total was 10.5. And again, the number of poor in million, 838. I would like now come to the European Union and the situation that we have, for example, in Germany related to social issues and living conditions. So you see, for example, in Germany, the rate was 17.5% for people at risk of poverty or social exclusion. Like you know, I'm original from Germany and I work in Germany as a professor. We are a very rich country, and to have such a rate is always, for me, very painful to see. And if you go to the right side, the inability to face unexpected financial expenses for the humans in Germany has a rate of 31.9%. Unbelievable. Brand new data from Germany. Yeah, this is a brief article just published in Germany. If this trend continues, soon every third person in Bremen, this is a city in the northern part of Germany, will be poor. So this is published by a huge organization in Germany, the Parity Welfare Association, and will give you an impression, that this city continues to have the highest poverty rate in Germany at 27.5%. For me, again, unbelievable in such a rich country. Like announced before, I will step forward to give you a few data about mental health issues, a few facts. So nearly 1 in 7 people around the world live with a mental disorder. Mental disorders can severely disrupt daily life and cause long-term suffering if left untreated. Most people do not have access to effective and necessary care. Data from the World Health Organization in 2025. In 2021, approximately 359 million people were living with an anxiety disorder, including approximately 72 million children and adolescents. In 2019, approximately 280 million people were living with depression, including approximately 23 million children and adolescents. Incredible numbers. I would like now to step forward, and I would like to present to you a few aspects and data related to a circle, specific circle. And I will show you data from the United Nations, and I will conclude it at the end. Poverty is, from my side, from my perspective, both a cause of mental health problems and a consequence. Women face a higher risk of poverty than men in all OECD countries except in Denmark, Finland, and Ireland. The largest gender poverty gaps are observed and documented, like you can see, in Estonia, Latvia, and Lithuania, where poverty rates among women are 4 to 5 percentage points higher than for men. On average across these countries, poverty is lowest among adults of working age, approximately age between 26 and 65, at around 10%, while it is higher at 12% for children and youth, and almost 15% for the elderly. The Office of the High Commissioner for Human Rights published about this topic in 2024 with the title, Growth Obsessed Economy Creating Unseen Mental Health Crisis for People in Poverty. Again, data about the whole topic. While 970 million people, or 11% of the world's population, experience a mental health condition, those on lower incomes are up to 3 times more likely to suffer from depression, anxiety, and other common mental illnesses than those with the highest incomes. Moreover, there is a strong correlation between education levels and income, and better education generally translates into better physical and mental health. People living on low incomes contact psychiatric services and other support services later than those from higher income households. In a systematic review and meta-analysis of 39 studies with altogether more than 8,000 homeless persons in Germany, a pooled prevalence of a current mental illness of, unbelievable, 76.2% was reported, with alcohol dependence being the most common disorder. Nutrition. Especially respondents with children were identified as the most vulnerable subgroup. This evidence is supported by findings of the Global Burden of Disease Study 2019, which reported in detail that child and maternal malnutrition was one of the leading risk factors for disability-adjusted life years. Breaking the circle. From my perspective, prevention is very important. Prevention in mental health has a long history, over 120 years. Since the early days of the mental hygiene movement at the beginning of the 20th centuries, many ideas have been generated on possible strategies to prevent behavioral problems and mental disorders. Prevention of mental disorders are always, and this is very important, a public health priority. Mental disorders have multiple determinants. Prevention needs to be multifaceted effort. It needs to be, again, a multifaceted effort. And like you can see, this was published in 2004, so a long time ago. Prevention needs to be considerate and sensitive to culture and to resources available across countries. Because many determinants, factors lie outside the health sector, effective promotion and prevention programs require cross-sector collaboration. Education, labor, justice, transport, environment, housing, and welfare sectors all have large and vital roles. Breaking the circle of poverty involves decent and productive jobs, sustainable enterprises, and economic transformation and security. Work can be a major route for many to escape poverty. However, working alone does not guarantee this, particularly if the working conditions are not decent. In 2019, more than 630 million workers worldwide, almost 1 in 5 of all those employed, did not earn enough to lift themselves and their families out of poverty. Respect and support for the human rights and labor rights are central to reducing poverty. I don't know if you are familiar with Oliver de Schutter. He reported in 2024 as the Special Rapporteur on Extreme Poverty and Human Rights of the United Nations that extreme poverty and human rights identifies the mechanism that expose people in poverty to a heightened risk of mental health conditions. And he examines how, despite the extraordinary resilience of many people in poverty, mental health issues can perpetuate poverty. He calls upon states to move from a biomedical approach to medical health, which treats it as a problem of the individual, to an approach that addresses its social determinants. I think this is very, very important. In order to combat the global tide of depression and anxiety, more should be done to fight poverty, or should be done to fight poverty and inequality, and to address economic insecurity. This is a very interesting circle. So the burnout economy break the circle. You see on the top, poor mental health. And then there is the circle with stigma, discrimination in unemployment, housing, and education, harmful coping mechanism, social isolation. And then you see the opposite, poverty and inequality, and difficult work situations. And we step forward with limited access to mental health care, green spaces, weak social protection, social isolation, status anxiety, and economic insecurity. I step forward to a world conference a long time ago in Rio de Janeiro in Brazil. I was one of the participants there, and we discussed about social determinants. And at the end of the conference, there was a political declaration on social determinants of health. And it was clear from all participants, we need more actions on social determinants of health. Was there a comment? Can you mute yourself? Thank you. Thank you. Okay. So this was a long time ago, and it's still a hot topic, like you have seen, related to mental health. And I have published with many colleagues a book about it. So about global mental health, prevention and promotion, and we included so many social determinants. And still today, we see how important it is to have further activities and engagement to reduce poverty. Poverty is much more as numbers. Further activities for better living conditions for people are necessary. Mental health promotion and prevention is necessary. Mental health access to support, help, and service is so important. From my perspective, it requires our engagement, our vigilance, and our commitment. Thank you for your immensely important work for mental health. I know you are very engaged in your country. Thank you so much. And thank you for your interest for my presentation. I will stop with my slides.
Thank you so much, Sabine. You have brought in very important points, as usual. As from the perspective of World Federation for Mental Health, you being the president of that organization, and it's also very important for us to have you as our guest here. Thank you. I would like to ask David Barron, if he would like to add any points. By the way, we have few number of participants among us, but I'm thinking that we will be able to discuss the perspective of medical students, what lessons they should take out of these valuable presentations. Thank you, Dave. Can we hear you?
Yes, can you hear me is the key.
We do.
All right. Well, thank you, Sabine, for sharing that. And I think what I'd like to do, as Boulant mentioned, is use these sobering numbers and bring them back to what does it mean for us? And I know we have many medical students on board, so this is really, comments could be used for others, but I'm going to focus more on medical students and early trainees, which is what SEED is largely was developed to address. I think there are a couple of very important points. One is that the answer to this problem is not just more money. The simple answer would be, well, if we have more money, everyone would be out of poverty. And that's just not the case. I can tell you from the United States, oftentimes there is a lot of money, but the money is not spent wisely. So certainly finances and resources are important, but the politicians and public health and public policy individuals, they need our help as health and mental health providers to make sure that the money is spent wisely. Because a lot of money that's not spent wisely sometimes can have a very minimal impact on addressing these very, very important topics that Sabine raised. So I think one thing is that part of our role as a health or mental health care provider is that we really need to get involved. Obviously, we're trained to take care of an individual patient, that patient sitting in our office. But I think that we see from this the important role of social determinants of mental health and physical health, and that we really need to be at the table, as Sabine so nicely pointed out. This is a team game. We have the World Cup starting here in the United States and in North America in just a week, so everyone is excited about a team game. But when we're talking about dealing with poverty and the impact on health and mental health, not only for the individual, but for a society, for a community, for a nation, we need to be an important part of that because we can share our expertise and knowledge in how we can spend our money wisely. Because if we don't spend it wisely, there are many, many, many examples of, and the best example might be in the city of San Francisco, where the APA meeting was held just a few weeks ago. At one point, they were spending a great deal of money to deal with drug issues and homelessness. And in fact, if anything, the problem might have gotten worse. They've got a new mayor in who started spending more wisely, received counsel from health and mental health professionals, and the city has made a pretty dramatic turnaround. So I think what we need to bring in is we are not, it doesn't mean that we have to run for politics, but we have to make the people who are making policy decisions aware of how important this is. And in fact, it's bad business to have so many very poor people. That we need to understand that what will motivate a banker or a businessman maybe isn't what motivates us as providers. We're looking at health and mental health. But in fact, it's a very bad business decision to have so many people who are unemployed or who are in poverty because they actually put a strain on the system for everyone. So again, I think it's the future is really in you, our students, our early career folks. Bulant and I have tried to make our contribution. We're blessed to be able to still have an interaction with you, but our future lies in you. And I think what I would hope that all of you can do is to understand that this, if we're concerned about health and mental health, if you're going into psychiatry or a mental health career, that we must understand this, we must get involved. And I'll share my own personal bias. I think that the most important work really happens at the community level. That it's great to have governmental public policy, but as Sabine so nicely pointed out, oftentimes there's corruption and graft. And I know I lived through. I'll share a personal statement. We had some very terrible fires about a year and a half ago in Los Angeles, where many people, including myself, lost everything I owned. And there were hundreds of billions of dollars really that poured in from all over the United States to help out the victims of the fires. And I can tell you, and I'm fortunate that that I'm not in poverty. I've been blessed to have a career in psychiatry as an academic and clinical research psychiatrist. Very, very little of that money actually made it to the people. The money was spent on fixing roads. The money was spent on other issues. So I think it becomes so important. And this I know is an important part of what the World Federation of Mental Health, because we're not just psychiatrists, and certainly the World Psychiatric, which many of our members are, but we need to be there to make sure that the message that Sabine just shared is out there, that this is an important part of a healthy economy as well as a healthy person, that we need to make sure that as best we can, we look for programs that are efficient and effective at a community level. Each community has got their own unique challenges and their own unique opportunities. So we need to be there to focus on the importance of mental health and physical health for the individual, but how this translates into health for a community, for a country, for really for the globe. So I think I see my dear friend and colleague Roy just joined us. So I think I'll stop here. But hopefully we can get some questions and comments. But I don't want any of our students to think like, well, I'm in medicine, so how can I deal with graft and corruption and politics and money? This is one of the really key components of maintaining, hopefully, an improved quality of life by addressing some of these issues, which are obviously much more dramatic in certain parts of the world, and it's going to take more work, but we all need to do this together. So thank you. And I see, Roy, maybe you could share some of your, a world leader who has worked in this area and has so much to share, and we've all learned so much from him over the years. Roy, could you maybe share some comments, please?
Hello. Yes. Am I muted or am I audible?
No, you're good, Roy.
Oh, yeah, I'm very nice day for all this, and I want to congratulate you for all the good thing you are doing and the section on psychiatry and primary care, medicine and primary care. I think this intergenerational thinking is very, very important. It's especially very relevant in countries of our, not only in the Western countries, but now it's all, the world is all a single global stage. So it's, I'm speaking from representing the low and middle income countries, which form probably 80% of the world. And I'm sure these thoughts will help us and will make our younger generation to involve in our mental health programs in a far more effective manner. That's all what I have to say. I'm busy. I'm sorry, I'm in the hospital, but I'm joining because of the importance of this function, and I'm in the busy outpatient department. Thank you very much for Dave. Thank you, all of you, for this organizing this wonderful meeting. Bulund especially, thank you very much. Thank you.
Roy, thank you for taking time.
Thanks for your being with us, Roy. We have young colleagues as well among us. But before going to them and asking their views, asking their thoughts, I would like to say, remind you about one thing. They say, I don't know, there is a saying, at least in Turkish, it's not fair to leave wars and decisions about wars and defenses only to soldiers. There is all the country, all the nation. And similar to that, and maybe especially on poverty issue, and poverty and mental health issue, it's not possible to leave this to mental health specialists. And what kind of lessons after this quotation can we think about what medical students could do or what they should think? Before asking our young colleagues, I would like to ask the main speakers first, Sabine and Dave.
Thank you very much, Roland, to give me the floor. I think from my perspective, what I would like to underline is give your patients, give your neighbors, give your family members information about the facts that I have, for example, shown today. The facts about mental health, the facts about the poverty worldwide. So I believe information is very, very important. The other side is we professionals, we quite often know the data. But it is also so important in your daily work or in my work with my students. Yeah, for example, yesterday at university, to deliver information, to discuss with them, to be open to their requests, their comments, and to have an exchange about it. Yesterday, we had a discussion about stigma. Who likes to talk about his own poverty? And to break the circle, yeah, this was my topic a few minutes ago. From my perspective, we have to include also the self-stigmatization to allow your patients to talk about poverty, about social determinants, about the real life situation. This is, for me, very, very important. I give over to my colleague, Dave. Thank you.
Well, I think that's a very important point. In fact, today I was doing some clinical supervision with some community health workers, not physicians, not even social workers, but people who work in the community, trying to provide mental health support services and evaluation and treatment. And one of the things that I found that all the cases they presented, and I think it gets to your point, Sabine, is allowing people the respect to listen to them. I think there certainly is prejudice. People might not want to talk about the fact that they don't have work, that they're going to be evicted from their home because they can't afford to pay the rent, or they don't have enough money to go buy groceries or to buy their medications. And they're embarrassed about that. They sometimes feel like they've been a failure, even though it might not have any. And certainly, as Sabine said, the data is very, very strong that people who are suffering from psychiatric disease, depression, anxiety, psychotic conditions are at a far greater risk for a number of reasons. So I think Sabine's point is an important one that all the students should understand, that we need to show respect to all of our patients by asking them. We need to educate them. Like, for example, it's not their fault maybe that the price of gasoline has gotten so high that people can't afford to fill their cars, so they can't get to work. I know in the Philippines, I had some colleagues of people were they just literally couldn't afford to get there. So I think we need to educate people that it's not that it doesn't necessarily mean that they're a bad person, that they failed in life. But in fact, this is a challenge that we all have to address together. And we're part of the team, the social workers, the teachers, educators, community service, religious figures, that really no one should be left out of it because it is so important. And each of us have something important to share, but I think we always have to listen to not only our patients, but to others. For example, a political figure might say, I would love to provide, free food for students as they come to school. And then the question is, but where am I going to get the money to do that? So I think it's, we oftentimes think that answers are simple. They almost never are. They're usually very complex, which I think requires that we need to work together respectfully, acknowledging that this is a real problem. And it's not just for somebody else, because it affects all of us. As Roy said, we're all interconnected. And I think the more that we can come together and work respectfully, educate each other about what the real issues are, that maybe we can come up with solutions that will allow us to improve quality of life for everyone.
Thank you. Thank you so much. Is there anything our younger colleagues would like to talk about? Yes, please, Shirnaz. She's a young, early career member, psychiatrist. She's a resident in Istanbul in psychiatry. Please, Shirnaz.
I have one comment. I am working in a foundation university for 3.5 years now, and this foundation university is normally they charge from patients, but for residents it used to be free, the outpatient clinic, and we had a lot of low-income patients. Lately, the foundation changed their policy and they started charging from patients for our polyclinic as well. So I lost mostly like half of my patients actually. Even though it's like 10 euros for one session, it's sometimes impossible for them to give that kind of money when their babies are hungry or they can't even afford the medicine and stuff like that. Or some high risk patients that I was seeing every week, for example, now they only come once a month or once in 2 months. So lately I've been struggling with that and there's no way out. So they started going to public governmental hospitals and stopped coming to us. We've been together for like 2-3 years and it's really sad to see that happening. I actually have a question for Professor Sabine. You said that women are at a greater risk of poverty, and I'm really into women's mental health. So I was going to ask you, I know one reason is the employment issues between women and men. They tend to get less income, even though they do the same work or something. But do you have any idea or any data about this? Why it's more common in women to have that?
Thank you so much for your request. Yes, I have data. I give lectures about it, and to summarize it for you today, and to offer it to you, if you would like to have more data, I can send it to Bülent, for example, and he can send it to you. There are several components, and what I always underline when I educate my students at university is that they understand to look always at the single case. So we have always to look, to the single woman, the single family situation, the specific conditions, the specific influences, the determinants, the age, for example, and the whole living conditions of this single woman. And then, yes, clear, we have data about specific components. I will give you one point for today. It's where are the women living? In cities or not in cities, with how many family members, with how many children in that situation. If you have to travel, from a rural place into a city for a specific task to work there to earn your money, then you have to find solutions for this period for your kids, for example. And sometimes it's impossible to find a good solution outside of a family network that women can work. So this is one point for today. But if you are interested, please send me a message, or I can send Bülent more data. Thank you so much for your interest.
Amazing. Thank you so much.
Yeah, and to address your other question, which I think is something that we've all struggled with, and this is where the team approach comes in. So I'm a former rector of a university where we had 6 different graduate schools, and I've been an assistant dean of a couple different medical schools and a department chair. So I've been on this side where, well, we need to bring in more money, and we've lost money. So what do we do? So we're going to charge the patients. I actually think unless you're in a wealthy area, when I was in Philadelphia, we had a big residency program, and there was a residency program that kind of catered to the very wealthy, and we were the program that dealt with those who essentially had no money. Almost all of our patients could not afford anything at all. But I view that as a potential strength. And why that was is because by me allowing our residents and our students to see patients for free, they got to see many more patients. So there were a lot of patients who were happy to come in if they didn't have to pay. In fact, what we started is we offered free daycare. So when the patients came, because many of them were women, we used our School of Social Work, so they were getting training in how to take care of young children, part of their education, and then we were offering free transportation. And what the result was is we had a lot of patients who came, so our students got to see many different forms of psychopathology, and I think it made for a richer educational experience where, in fact, the rich university in town wanted to send their residents to our place so they could see more cases. The other thing is you have to be creative. So a current program I'm working with now in a very poor area just outside of Los Angeles, again, we see almost exclusively patients who have no money and can't afford. So, but we have a large pay. So we went out and we wrote grants, and now I'm bringing in more money in grants than if these patients were paying to be seen. So I bring these as examples that you have to be creative, that don't view patients from the lens of, well, if they don't pay, I'm going to lose money. What resources do they bring in? We've been able to go to very wealthy people who, in fact, through philanthropy, said, well, we'll donate money to run this free clinic. So I think it requires creativity, that the business men and women are only looking at how can we bring in more income. And oftentimes they're very different and creative ways. And one of the things I've been very impressed with, I've been very lucky to travel and spend time in low and middle income countries, how the very creative are the ones who are able to develop really quite effective treatments and programs with very little in the way of resources because they look for other ways to do it. So I think maybe sharing with your with the folks at your school that having access to more patients will improve the quality of the education, and that maybe mean that you get better students and students. At least in the U.S., I know oftentimes in the rest of the world, they're paying some tuition, but then you have grants and you have other opportunities for to generate money. So I think, and then sharing with them, as Sabine said, education is so important. Educating them that just by charging money could actually kill the program because people won't be able to come in. And then if you don't have enough patients, your program will lose certification. So then you won't have students there, and the government. And so I found working with government being creative, keeping good data, educating people, and really kind of what in the States we say kind of sometimes thinking out of the box can lead to some very interesting solutions that can turn out to be actually far better than if you didn't have that challenge. So I think it's a wonderful question. You're right, and one that I think will only continue to be an issue as we saw from Sabine's data. Poverty and income in most of the world is not going up; it's going down. Prices are going up. We talk about inflation, oil, everything else. So I think your question is really important. That how do we do what we need to do with less resources and identify other potential ways to keep the programs going so that we have high quality education, we have well trained physicians, residents, psychiatrists, whatever, and then again looking at the big picture, getting involved with communities, very important because each community has its own unique challenges and advantages. But just an excellent comment. Thank you.
You actually gave me a lot to think, and I'm thinking like one day free care might be something that my foundation would be okay with. So I'm gonna go and ask them if it's possible to make this. Thank you.
Well, what we did is we actually made it our School of Social Work. We had a number of students who were interested in early childhood development. So we actually had those students, and they viewed it as a real opportunity. We didn't have to pay them; they were still in training, and they ran the daycare. And they did, and we had some of our education students who were training to be elementary school teachers. They were still in training, and they would come and get a chance to spend some time there. And by offering free daycare and offering transportation, the number of women who came, and what we found, we followed this over a number of years, is that as they were able to get the treatment they needed, many of them were able to get back to work. And it ended up being a very positive impact. So I think we have to look at opportunities that we had students who wanted to see young kids. We had young kids who needed to be seen. And I think there's opportunities, but we have to be willing to sit down and learn and listen from each other. And I'm a very firm believer that we have not treated women particularly well in the workplace. And I think women bring so much more, sometimes even than men, in their ability to be empathic, to be caring. Not that men can't do that as well, but I think having women in the workforce and making it easier for them to be good mothers as well as take care of themselves is an important part of what we should all do as healthcare and mental health care providers.
Thank you so much, Dave. We have another early career psychiatrist among us, IgM, who was with SEED when she was a medical student, but now she is a psychiatry resident. Then we may ask Jannet, Bartu, and Adnan. There was Raid. He's coming and going. Well, IgM, is there anything you would like to add, ask, or contribute?
Hello everyone. So I'm on call today actually. So I have missed the beginning of the meeting. I'm sorry for that, but I will try to catch up from the YouTube. But thank you for this discussion and conversation. Nowadays we are trying to do that something something like Shirnas has already mentioned, I'm working at a private university hospital right now, and I mean the session prices are really high here, so it's difficult for everybody to pay them, and even our like medical students and other residents, and for example, some of the workers are in here in the hospital are trying to seek mental health care, even for like their themselves both and their relatives and everything, and we are trying to include that to our program actually recently. I mean, it can be sometimes difficult, but we are trying to have like resident psychiatry polyclinic, something like that, which can have like lower prices and everything. I'm not sure if we can like manage that and we can have that, but hopefully we are trying to do that. And I mean, in general, of course, it's needed, but in here our hospital is like a mental health hospital, and I mean our like professionals here also are actually in need of seeking mental health, and we need to do that for everybody. So I can add that, and thank you for this conversation and discussion.
Thank you. Thank you. Janet, would you
Hello, everyone. I
please?
hope you're doing well. Am I
So-
audible?
Please, please.
Yeah. So I've been listening all this time and I've been wondering a lot of things. Professor Sabine mentioned the statistics of Europe, and frankly and realistically speaking, the financial situation or the poverty situation in Europe is much better. Like she said, that she lives in Germany and it's a very rich country. And obviously, I come from the part of the world which had been colonized and then had gained its independence just 75 years ago. And along with that, colonialism and the political situations, I'm not sure if a lot of you are familiar with this political situation and the history of our region, subcontinent, Pakistan and India. So the thing is that when we talk on these forums, a lot of times, unfortunately, unintentionally, we sometimes miss that the middle and lower income countries usually have it harder. For example, if you look at Pakistan, the poverty rate is at 29%, 28% almost, and 70 million of the 250 million population lives below $4 a day. And even then, 16% of the population is below the level of extreme poverty. And the situation here is worse because obviously the resources have been replenished and there's economic instability, there's political instability. And along with that, we have have been seeing a lot of brain drain due to all of these things. So it creates a sense of uncertainty and anxiety among both our elders and our youth. Pakistan usually it consists of a very large population of youth. I think almost 60% of our population is adolescents and young people. So when this uncertainty comes into play, I think everybody in my colleagues and my friends, we've all experienced some sort of issues in our mental health. Along with me, we often sit down and talk about our struggles and our worries, and I see it. It's something very normal. Growing up, it's something very normal to have had mental health issues and to have had anxieties or some form of depression or social isolation. And since I work at a public hospital, a public university, I'm studying here. The problem here really is not money, I think. The resources are sparse, yes, but in my experience, my colleagues and my seniors, they do everything in their part to make it work. Bigger amount, but the bigger issue is that since the resources are not enough for a very huge population, there's a lot of stigma around it because we can't really talk about these things. We don't really have the opportunity to advocate for these things. And that stigma, it exists everywhere, not in just public hospitals or even in the elite circles or the posh circles, the stigma exists. So, and then again, I'd like to add that it really isn't about money as well, because the stigma that leads to it. I think poverty is, I am a bit all over the place. My thoughts are a bit scattered. I'm sorry for that. Poverty, I think, also leads to a lot of social habits. Like Dave mentioned, that there are some social determinants that lead to mental health struggles. They play a part along with poverty, and in Western societies, drugs and alcohol abuse and stuff like that, they create a very important role in creating these issues. And then there's policies that we have in our countries, in our systems, that we can't really go around, and we can't really fight those policies. So I think we've done enough talking about all of these things, and we've mentioned it enough along the years, ever since the SGDs and the MGDs were put forward. There have been a lot of discussions about these things. The thing is that we aren't really able to think of any solutions, like what should be done to cater to the needs of our population, what should be done to make the situation better. Of course, first comes the accessibility part. We have to make it accessible, and we have to destigmatize all of these aspects of mental health, and we have to talk about them. We have to advocate for a better system, a better better opportunities to talk. As I have mentioned before, I have been the president of a mental health society in my college, and we have had a lot of opportunities to talk to people on many different levels. That included talking to parents of students that have had mental health issues, young kids, adolescents, elder population that come to us as patients, our own colleagues, our seniors, certified psychiatrists, and has done, what has the World Mental Health Federation has done for to improve the situation. So like Dave said, we have to create opportunities, we have to be creative with our solutions. And I really liked his idea of creating a space where students could interact with students who wanted to learn about children. They could interact with the children, and everybody was getting something from that system that the university at which Dave works created. So the creative solution, and of course, money. We are tight on resources, so of course, money plays a huge role. And I think we need to up it a bit when it comes to grants, and we really can't at this point, because the gasoline prices and the current situation is in front of everybody. Everybody knows what's going on. So yeah, it's very disappointing sometimes. You want to help a lot of people and you want to make a difference, but you can only do so much. So sometimes it gets frustrating, and sometimes it gets annoying, and you get sad about these things. But one can only hope, and one can only keep their eyes open. Somebody mentioned, yeah, Dr. Sabine mentioned that who likes to talk about poverty, and she's absolutely right about that. Nobody likes to mention their struggles, especially when it comes to strangers, because doctors are mostly strangers at first. So I think what we can do in our part is to be observant. We need to keep an eye out and on what's going on around us. It's very difficult to see the bigger picture because it's painful. It's not a comfortable experience to look at the bigger picture and see, to be able to see what's going on and not be able to do anything about it. But we have to learn to be uncomfortable. We have to accept that discomfort and go forward with it. And intentions again matter. And I think we have to have the courage to accept what is and try to change it. Thank you.
Thank you, Janet. You have given a lesson to all those participants, to all of us. Thank you. And we have three other young colleagues, Bartu, Fred, and Adnan. Does any one of you want to say anything?
Yeah, sure. Can you hear me?
Yeah, please, go ahead.
Yeah, thank you very much for this interesting session.
We can't hear you now. Could you open your sound? Says,
Yeah, can you hear me now?
Now, yes.
Yeah, so I was wondering about many things when the professor and other uh, uh, medical professions was talking about this poverty and the social strata, and uh, I was wondering, there is a pill about mental health, but there is no pill about poverty. And I think Mr. Dave was talking about some programs. I will be very interested to learn more about those programs and what you are going to do to cater these issues on the lower strata of the society. Because as Dr. Jannat has highlighted already, that there is two things, very important things. One is destigmatization, and the other is the poverty rate as compared to the Europe is way too higher for our third world countries. So I would be very interested in seeing what programs you are having and how the resources can be distributed in third world countries. And there are a lot of people, as Mr. Deva was saying, that if you provide free daycare, they are coming, otherwise they are not coming. And I think a lot more people are not coming. Even then, they don't have the time or capacity or energy to attend these sessions, or they don't have any idea that what they are going through. So I think we should be focusing on this you know uh, uh, this variant, this specific target, that how we are going to make a policy about this, how we are going to implement on the ground levels.
Yeah.
Yeah.
Well, it's a very good question. I'm really happy to share with you because I want to pick up on a very important point that our last colleague made, and that's what it can get very frustrating. If our goal is to get everybody, to be at the level that, they have the financial resources and the food and the housing and it will be frustrating because it's like, how can I ever do this? So I think what we have to understand as providers is we have to take baby steps. We have to crawl before we walk, before we run. And by that, I mean, maybe we're not going to be able to take care of some of the most important things right away. Hopefully, down the road, that'll happen. But what can we do? And I'll give you an example. I was fortunate enough, I did a couple of Fulbright scholars. I was a two-time Fulbright scholar. And one of the ones I did was in Malaysia. Now, we were in the jungles outside of Sabah. I mean, there was no money. It was, this was, but yet the resources they had is they had each other. So we had some of the older women in the community who had no formal training in school, but they had raised many children. They knew, and we set up support where they could speak to the younger mothers in the community about what it meant, because they knew the challenges in their tribe, in the jungle. They were solutions that worked in Los Angeles would have been stupid to even talk about because it was such a different. I mean, they were literally going down and getting water from the river, and they were eating what they could, what they were able to kill in the jungle. It was a very different. It was a wonderful experience for me. But what it taught me is that oftentimes the resources within the community. So we had older children, older adolescents in the tribe would work with the younger kids. The old idea that it takes a village or a tribe to raise a child. So I think we have to be willing, as we heard from the very excellent comments just made, that sometimes we maybe need to have our expectations be a bit lower, because otherwise we'll get burned out, we'll get frustrated, and we'll just say, we'll get depressed. And that doesn't help anybody. But if we have very modest, like maybe what we can do in this community is create a place for children to go in the afternoon who aren't working out of school, where maybe they can do, we did a project in Italy where they would just get together and they would dance and they would tell each other stories and they would do artwork. And it's something that made them feel good, but it didn't really cost anything. So I think the answer is not to say, well, a lot of money will do it, but what are the resources and the challenges in this particular community? Maybe maybe you have a good school system. Maybe you have, a strong religious community. Each is unique. Each is different. We have to listen to each other, but make small advances and build on those. So, what turns out to be getting together might turn into supportive group therapy, not having people feel embarrassed that they don't have money, they don't have the clothes that they would like, they see on YouTube that everyone wears, which is, or the internet. So really educating, getting back to Sabine's comments, but really understanding where people are and dealing with stigma, which is such an important area. Many people don't want to talk about their use of drugs because they're embarrassed, but it's the one time where they're not feeling emotional pain when they're high. So we have to destigmatize at many levels, and work with the resources that are there, taking small steps and then building on those small successes, having people start to feel good about themselves or feel better or feel like there is a future for them. Maybe not right away, but that we're going to be working towards that. Because I think if people feel demoralized and depressed, then that just leads to more psychiatric symptoms, but it also leads to other socioeconomic issues.
Yeah, I think we are coming to the end, but before closing, would Bartu or Fred like to share their views?
Thank you for all comments. I am 50-year medical student, and it's a great pleasure for us to come together with professors like you and benefit from your ideas and your sharings. I would also thank to Professor Josh Kuntu making it possible for us to come together with you. Thank you.
Thanks a lot, Bartu. Fred, do you want to add your thoughts before we close? We can't hear you now. We can't hear you.
How about now?
Now we can.
It's a privilege to be in this platform, learning from great professors and my fellow medical colleagues. I'm a second-year medical student. Though I was on and off, I catch up a bit late. I would like to give my comment or questions. Mr. Dave was quite clear about being creative, but my point is there's geographical differences, and I could give you a kind of a life experience and a practical example as well. At the moment, I'm at the hospital doing my attachment, and I know all of you have known or heard of country South Sudan, the youngest one. I'm from South Sudan. But when you look at the hospital, the patients themselves could not really afford to get medicine. and not only even to get transport to do follow-ups. So in that kind of context where getting access to resources, things are really scarce, leave alone going after grants. In that kind of situation, as medical personnel, what can you do to the patient? What kind of assurance can you give them? Because we know poverty itself is a disease. Is a disease, and we need to prepare ourselves. I mean, like prepare the patients as well to find ways on how to, combat this. I think that's a few things I would like to put this moment, and then I'll carry on from there. Thank you.
Thanks, Fred, for sharing your views. And maybe before closing, I can ask David and Sabine once more to make their last comments. Who wants to start?
Perhaps I can start.
Please.
Yeah, it was very impressive for me to hear all your comments and your requests. And at the end, I would like to underline the importance of our federation. Yeah, like Dave and I, we work together in the World Federation for Mental Health. And in my position as the president, I have now possibilities, invitations, for example, from other governments, to present, for example, in 10 days, in Germany, in Berlin, about poverty and mental health. And these invitations, they give me, as the president, the opportunity to underline hot topics, to governments, to chairpersons. And I think beside all the discussion that we had today, it is important to have more power for mental health issues around the world. And in my function as the president, I have now the opportunity to speak with chairpersons, stakeholders, and I will use my period, the next 18 months, 17 months, to step forward in that direction. And I will not forget, thank you, Bilal, and I will not forget my own roots. And I will not forget how important it is to educate. But we need these strong relationships, and we need to step this, from my perspective, very important topic, mental health, to powerful people, decision makers in the world. Thank you very much.
And maybe, thank you so much. Maybe the most powerful people are the young people who are our future, as we usually use this with Dave. They are our future, and I'm sure you have taken notes of what these young colleagues have said. Dave, before closing, what will you say?
Well, it's after 2 a.m. in Los Angeles, so I want to keep it brief. But one of the things I want to share with our young colleagues particularly is don't get too frustrated. You are our future. We need you moving forward. Sometimes it will seem painfully slow in the process, and we might take one step forward and two steps backward. But just like a patient with a chronic illness, we're there to help them rehabilitate themselves. Well, we need to rehabilitate society and government and a whole bunch of other things. So I would say a small contribution, maybe running, going in on a weekend, running a free group session, working with the local sports teams. I saw one of our colleagues had his Man United shirts on. I've gotten very good support from the professional sports leagues to help with some very impoverished areas. So be creative, but be proud of what you're doing. Don't get frustrated. Say, I'm in here trying to help, and I was blessed to be able to be in a field where I can try to make a difference. And yes, many countries in the world, it can get very frustrating to look at the big picture, but sometimes what can I do for this individual person, for my community, to go and speak at a school to young children, to educate them about the importance of them getting a good education, about simple things that are very important for health, getting good regular sleep, trying to help them understand and deal with stresses. There are so many things that we can do that don't necessarily require a lot of money. Money obviously always helps, but don't get frustrated. Be proud and thankful of the opportunities that you have. And I'm sure if you work hard, you will make a difference. And when you get to the age of Bulan and Sabine is much younger, so I'm not going to include her, but you can look back and say, I worked hard and I can feel very fortunate that I was able to make even a small difference. You will all make a huge difference. And don't allow yourselves to get burned out because we need you.
I'd like to add a few things here, I think, as a final closing comment. One thing is that you often hear a lot of people, a lot of creators, and a lot of artists talking about a lot of artists that are passionate about mental health. They often talk about the fact that mental health struggles are a result of the system that we built, the system of capitalism that we've built over the years after the industrial revolution, and it is a consequence. And sometimes it's not really it's a product of the system that you're living in. And we need to understand, and we need to make other people understand that poverty is not a personal failure. It's a product and a set of social conditioning, social situations, political instability, along with the systems that we have put forward that are not working for them, for ourselves anymore. And we need to understand that we need to throw out the systems that are not working for ourselves, not violently, but we need to grow through it and understand it, and be brave enough to make changes, to be brave enough to go through the uncomfortable process of changing. And we need to educate people about these things, because a lot of people, they don't really understand the whole a nexus. There's a nexus that exists, and it's very important to understand that nexus.
Thank you.
Very good.
Thank you so much. And we can believe that we have a representative of our discussions to be shared with the world through our president of World Federation for Mental Health. She has got your messages, my young friends. She will carry them along. Thank you, Sabine, for being with us. Thank you, everybody, for being here.
Thank you, Balan, for putting this together. Be well, everybody, and be safe.
Good morning.
Thank you. Have a good day. Have a good night.
Yes.
Okay.
Off to bed.
Sleep well, Dave. Thank you so much.
Bye-bye.
Bye.
Bye.